201. Which hormone is primarily responsible for regulating calcium levels in the blood? Answer: parathyroid hormone. Explanation: parathyroid hormone, secreted by the parathyroid gland, regulates calcium levels, critical for assessing bone and neurological health in endocrine disorders. 202. What is the primary nursing action for a patient with a blood glucose level of 40 milligrams per deciliter who is alert? Answer: provide oral glucose. Explanation: providing oral glucose corrects hypoglycemia in an alert patient, a critical intervention to prevent neurological complications and ensure patient safety. 203. Which gland is responsible for follicle-stimulating hormone secretion? Answer: pituitary gland. Explanation: the pituitary gland secretes follicle-stimulating hormone to regulate reproduction, critical for assessing endocrine function in disorders like hypogonadism. 204. What is the primary symptom of a patient with diabetic ketoacidosis? Answer: rapid breathing. Explanation: rapid breathing, or Kussmaul respirations, compensates for acidosis in diabetic ketoacidosis, guiding urgent insulin therapy to ensure endocrine patient stability. 205. What is the priority nursing action for a patient with suspected adrenal insufficiency? Answer: administer hydrocortisone. Explanation: administering hydrocortisone corrects cortisol deficiency in adrenal insufficiency, a critical intervention to prevent crisis and ensure patient safety. 206. What is the primary patient education topic for a patient with type 1 diabetes on insulin? Answer: rotate injection sites. Explanation: teaching rotation of injection sites prevents lipodystrophy, a critical step to ensure effective insulin absorption and endocrine patient safety. 207. Which laboratory test confirms hypothyroidism? Answer: elevated thyroid-stimulating hormone. Explanation: elevated thyroid-stimulating hormone indicates hypothyroidism, guiding levothyroxine therapy to restore endocrine function and patient energy levels. 208. What is the primary nursing intervention for a patient with hyperthyroidism experiencing heat intolerance? Answer: provide a cool environment. Explanation: providing a cool environment alleviates heat intolerance in hyperthyroidism, a critical intervention to ensure patient comfort and endocrine stability. 209. Which hormone is oversecreted in a patient with Cushing syndrome? Answer: cortisol. Explanation: excess cortisol causes weight gain in Cushing syndrome, guiding endocrine assessments and interventions to manage metabolic complications and health. 210. What is the primary symptom of hypernatremia in a patient with diabetes insipidus? Answer: confusion. Explanation: confusion, due to elevated sodium from water loss, signals hypernatremia, guiding fluid replacement to ensure neurological and endocrine patient safety. 211. Which gland is responsible for insulin secretion? Answer: pancreas. Explanation: the pancreas secretes insulin to regulate blood glucose, critical for assessing metabolic control in endocrine disorders like diabetes mellitus. 212. What is the primary nursing action for a patient with a blood glucose level of 350 milligrams per deciliter? Answer: administer insulin as prescribed. Explanation: administering insulin lowers severe hyperglycemia, a critical intervention to prevent complications like ketoacidosis in endocrine care. 213. Which hormone is deficient in a patient with Addison's disease? Answer: cortisol. Explanation: cortisol deficiency in Addison's disease causes fatigue, guiding hydrocortisone therapy to restore endocrine function and patient stability. 214. What is the primary patient education focus for a patient with type 2 diabetes? Answer: monitor blood glucose regularly. Explanation: teaching regular blood glucose monitoring ensures early detection of fluctuations, a critical step to prevent complications and maintain endocrine health. 215. Which laboratory test monitors glycemic control in diabetes over months? Answer: hemoglobin A1C. Explanation: hemoglobin A1C reflects average blood glucose over months, guiding diabetes management to prevent endocrine complications and ensure patient health. 216. What is the primary nursing intervention for a patient with suspected hyperosmolar hyperglycemic state? Answer: administer intravenous fluids. Explanation: intravenous fluids correct dehydration in hyperosmolar hyperglycemic state, a critical intervention to stabilize endocrine function and prevent organ failure. 217. Which hormone is oversecreted in a patient with acromegaly? Answer: growth hormone. Explanation: excess growth hormone causes enlarged features in acromegaly, guiding pituitary assessments and interventions to manage endocrine complications. 218. What is the primary symptom of a patient with diabetic neuropathy? Answer: numbness in feet. Explanation: numbness in feet, due to nerve damage, signals diabetic neuropathy, guiding foot care to prevent injury and ensure endocrine patient safety. 219. What is the primary nursing action for a patient with a blood glucose level of 25 milligrams per deciliter who is unresponsive? Answer: administer glucagon. Explanation: administering glucagon raises blood glucose in unresponsive hypoglycemic patients, a critical intervention to restore consciousness and ensure safety. 220. Which gland is responsible for calcitonin secretion? Answer: thyroid gland. Explanation: the thyroid gland secretes calcitonin to regulate calcium, critical for assessing bone health in endocrine disorders like hyperparathyroidism. 221. What is the primary patient education topic for a patient with hypothyroidism? Answer: report weight gain. Explanation: teaching patients to report weight gain ensures early detection of hypothyroidism worsening, a critical step to adjust therapy and maintain endocrine stability. 222. Which hormone is deficient in a patient with hypopituitarism? Answer: multiple pituitary hormones. Explanation: hypopituitarism involves deficiency of multiple pituitary hormones, guiding hormone replacement to restore endocrine function and patient health. 223. What is the primary nursing intervention for a patient with suspected diabetic ketoacidosis? Answer: administer intravenous insulin. Explanation: intravenous insulin lowers blood glucose and halts ketone production in diabetic ketoacidosis, a critical intervention to reverse acidosis and ensure safety. 224. Which laboratory test confirms pheochromocytoma? Answer: elevated metanephrines. Explanation: elevated metanephrines in urine or plasma confirm pheochromocytoma, guiding treatment to manage catecholamine excess and ensure patient health. 225. What is the primary symptom of hypokalemia in a patient with hyperaldosteronism? Answer: muscle cramps. Explanation: muscle cramps, due to low potassium, signal hypokalemia, guiding electrolyte replacement to prevent neurological complications and ensure safety. 226. What is the primary nursing action for a patient with a blood glucose level of 600 milligrams per deciliter? Answer: notify the healthcare provider. Explanation: notifying the healthcare provider ensures rapid intervention for severe hyperglycemia, a critical step to prevent hyperosmolar state and ensure patient safety. 227. Which hormone is oversecreted in a patient with prolactinoma? Answer: prolactin. Explanation: excess prolactin causes galactorrhea in prolactinoma, guiding endocrine assessments and interventions to manage pituitary function and patient health. 228. What is the primary patient education focus for a patient with Cushing syndrome? Answer: monitor for infection. Explanation: teaching infection monitoring reduces risks in Cushing syndrome due to immunosuppression, a critical step to ensure endocrine patient safety. 229. Which gland regulates metabolism through thyroid hormone secretion? Answer: thyroid gland. Explanation: the thyroid gland secretes thyroid hormone to regulate metabolism, critical for assessing energy levels in endocrine disorder management. 230. What is the primary nursing intervention for a patient with suspected thyroid storm? Answer: administer propylthiouracil. Explanation: propylthiouracil inhibits thyroid hormone synthesis in thyroid storm, a critical intervention to reduce metabolic rate and ensure patient safety. 231. Which hormone is deficient in a patient with hypoparathyroidism? Answer: parathyroid hormone. Explanation: Parathyroid hormone deficiency causes hypocalcemia, guiding calcium supplementation to prevent neurological complications and ensure patient safety. 232. What is the primary symptom of a patient with diabetic foot infection? Answer: redness and swelling. Explanation: redness and swelling signal diabetic foot infection, guiding antibiotic therapy and wound care to prevent amputation and ensure endocrine patient safety. 233. What is the primary nursing action for a patient with a blood glucose level of 150 milligrams per deciliter post-meal? Answer: document and monitor. Explanation: documenting and monitoring post-meal glucose ensures accurate tracking, a critical step to adjust therapy and maintain endocrine patient stability. 234. Which laboratory test monitors adrenal function in Addison's disease? Answer: ACTH stimulation test. Explanation: the ACTH stimulation test assesses cortisol response in Addison's disease, guiding hormone replacement to restore endocrine balance and patient health. 235. What is the primary patient education topic for a patient with hyperthyroidism? Answer: regular follow-up appointments. Explanation: teaching regular follow-up appointments ensures ongoing hyperthyroidism management, a critical step to prevent complications and maintain endocrine stability. 236. Which hormone is oversecreted in a patient with Conn syndrome? Answer: aldosterone. Explanation: excess aldosterone in Conn syndrome causes hypertension, guiding endocrine assessments and interventions to manage fluid and cardiovascular risks. 237. What is the primary nursing intervention for a patient with suspected hypocalcemia? Answer: administer calcium gluconate. Explanation: administering calcium gluconate corrects hypocalcemia, preventing neurological complications like tetany, a critical intervention for endocrine patient safety. 238. Which gland is responsible for adrenocorticotropic hormone secretion? Answer: pituitary gland. Explanation: the pituitary gland secretes adrenocorticotropic hormone to stimulate cortisol production, critical for assessing adrenal function in endocrine disorders. 239. What is the primary symptom of hyperthyroidism in a patient? Answer: tremors. Explanation: tremors, due to increased metabolism in hyperthyroidism, guide thyroid assessments and interventions to restore endocrine stability and patient comfort. 240. What is the primary nursing action for a patient with a blood glucose level of 85 milligrams per deciliter before exercise? Answer: provide a carbohydrate snack. Explanation: providing a carbohydrate snack prevents exercise-induced hypoglycemia, a critical intervention to ensure endocrine stability and patient safety during activity. 241. Which hormone is deficient in a patient with Sheehan syndrome? Answer: multiple pituitary hormones. Explanation: Sheehan syndrome causes multiple pituitary hormone deficiencies, guiding hormone replacement to restore endocrine function and patient stability. 242. What is the primary patient education focus for a patient with diabetes insipidus? Answer: carry desmopressin. Explanation: teaching patients to carry desmopressin ensures rapid treatment for diabetes insipidus, a critical step to prevent dehydration and ensure endocrine safety. 243. Which laboratory test confirms Cushing's syndrome? Answer: dexamethasone suppression test. Explanation: the dexamethasone suppression test confirms cortisol excess in Cushing's syndrome, guiding treatment to manage endocrine complications and patient health. 244. What is the primary nursing intervention for a patient with suspected diabetic retinopathy? Answer: refer to ophthalmology. Explanation: referring to ophthalmology ensures early detection of diabetic retinopathy, a critical intervention to prevent vision loss and ensure endocrine patient safety. 245. Which hormone is oversecreted in a patient with hyperparathyroidism? Answer: parathyroid hormone. Explanation: excess parathyroid hormone causes hypercalcemia, guiding endocrine assessments and interventions to manage skeletal and neurological complications. 246. What is the primary symptom of a patient with hyperosmolar hyperglycemic state? Answer: altered mental status. Explanation: altered mental status, due to severe dehydration, signals hyperosmolar hyperglycemic state, guiding fluid therapy to ensure endocrine patient stability. 247. What is the primary nursing action for a patient with a blood glucose level of 250 milligrams per deciliter? Answer: administer insulin as prescribed. Explanation: administering insulin lowers elevated blood glucose, a critical intervention to prevent hyperglycemia complications in endocrine care. 248. Which gland regulates blood pressure through catecholamine secretion? Answer: adrenal gland. Explanation: the adrenal gland secretes catecholamines to regulate blood pressure, critical for assessing cardiovascular stability in endocrine disorders like pheochromocytoma. 249. What is the primary patient education topic for a patient with adrenal insufficiency? Answer: increase steroids during illness. Explanation: teaching steroid dose increases during illness prevents adrenal crisis, a critical step to ensure endocrine stability and patient safety. 250. What is the primary nursing intervention for a patient with suspected hyperthyroidism? Answer: monitor vital signs. Explanation: monitoring vital signs detects complications like tachycardia and hyperthyroidism, a critical intervention to ensure patient safety and guide endocrine treatment.